Hello, my name is Shirley. I'm a member of the clinical team at Chartwell Hospital. This video will be me describing your colonoscopy procedure with MoviPrep bowel prep. If you would like me to describe your colonoscopy with Fleet bowel prep or Pickalax bowel prep, please see a link in the description below. If you're coming for a morning appointment for a colonoscopy with MoviPrep, the day before your procedure, you may have a breakfast at 7 o'clock in the morning. This should be a light breakfast, such as some toast or a cereal from the chosen list that we've given you. After you've had your breakfast, you're to have no more food now until after your procedure. You can now make up your first bag of MoviPrep solution. Take one clear bag and remove the sachets A and B. Mix them both together with lukewarm water in a 1 litre jug. You can place this in the fridge as it's easier to drink when it's a little more chilled. It's important now to keep up your clear fluids. At 1 o'clock in the afternoon, you can start drinking the MoviPrep, and we'd like you to drink 1 glass every 15 minutes until it's all gone. That should take you about 1 hour. Once you've finished your first jug of MoviPrep, it's a good idea to make up your second jug for later in the day. So again, you mix sachets A and B in a litre of lukewarm water and put that in the fridge to be chilled to start drinking at 6 o'clock in the evening. At 6 o'clock in the evening, you can start drinking your second jug of MoviPrep, 1 glass every 15 minutes until the whole jug is gone. It may help to drink water in between your glasses as well. And it's important to keep all of your fluids going all through the whole of the day and of the evening. So drinking both the jugs of MoviPrep will give you diarrhea. That's what we want. We want to clear your bowel, ready for your procedure. Just remember to keep lots of fluids going, not just water, but sugary fluids too. And we will give you something to eat and drink after your procedure. For your afternoon appointment for colonoscopy with MoviPrep, the day before your procedure, you may have a light lunch at 12 o'clock. This should consist of some toast or some soup, but nothing with high fibre like fruits and vegetables. After your lunch, you should eat no more food now until after your procedure. This is a good time to make up your first sachets of MoviPrep solution. You can take 1 clear bag and remove sachets A and B, mix them together in a 1 litre jug with some lukewarm water and put that in the fridge. For the rest of the afternoon, you should be drinking lots of fluids, not just clear water, but fluids with sugar in to keep your energy up. From 6 p.m, if you start drinking your MoviPrep, you should drink 1 glass every 15 minutes until it's all gone, and that should take you about 1 hour. This will be a good time to make up your second lot of MoviPrep. So take your second clear bag, remove sachets A and B, and mix them in a 1 litre jug with lukewarm water, and put that in the jug to chill overnight. For the rest of the evening, it's important that you do keep your fluids up. Not just clear drinks, but things with sugar in to give you lots of energy too. On the day of your procedure, at 7 o'clock in the morning, you can start to drink the second jug of MoviPrep. So 1 glass every 15 minutes until it's all gone, and that will take you about 1 hour. For the rest of the day until your appointment, you can drink clear fluids up until about 2 hours before your procedure. After your procedure, we'll get you something to eat and drink. Once you come into the hospital, you'll go to one of our friendly receptionists and they'll ask you to fill out a questionnaire. Once that's been done, they'll call a member of the team who will come down and they will take you up to our admission room, which is on the first floor. We have stairs or a lift if a lift is required. Once you go into the admission room, a member of the team will go through a questionnaire with you. This is your chance to ask them any questions as well. Please feel free to do that. A colonoscopy procedure involves our specialist doctor passing a fibre optic camera into your lower part of your bowel, and that goes round into different parts of your colon. Your lower colon, which is your sigmoid colon, up and round a little bit into something called your descending colon, up to a little bend and then across to your transverse colon, around another bend and down into your ascending colon. This whole test takes between 15 and 20 minutes. The specialist doctor will come in and will chat to you and may ask you some questions. This is your chance to ask him any questions that you may have as well. When you're happy he's explained everything to you, he'll ask you to sign a consent form, and that is you agreeing that he can do the procedure. Once you've signed your consent form, we'll ask you to get changed in our changing room. That will involve putting on a pair of dignity shorts and a gown. The staff on the day will explain to you what items of clothing you may leave on and what you need to remove. Once you're changed, someone will take you through into the procedure room and you'll sit on the bed and another team member in the room will ask you some questions. We will lay you down and we'll put some monitors on you. We'll monitor your blood pressure and your pulse, and we'll put some oxygen on through a little cannula that will sit in your nose. You'll be lying on your left side and there'll be a TV screen for you to watch the procedure if you'd like to. When you have sedation, the doctor will put a small cannula in the back of your hand or in your arm. This will enable him to give you the sedative which will relax you throughout the procedure. Once the doctor has placed the cannula in the back of your hand or your arm and he has given you the sedative, it works almost immediately. It will relax you, but you will always have full control of your actions at all times. Because we're giving you sedation, we do have to give you oxygen, and that will be through a little nasal cannula that will sit in your nose. We'll also put a small probe on your finger to monitor your oxygen levels and your pulse. If you've had a sedative and a painkiller, there are instructions you will need to follow quite closely, and that is mainly no driving for 24 hours, no alcohol on that day, and someone to stay with you for at least 12 hours, or if it's an afternoon procedure, overnight. Another option for you is Entonox. What happens is when you go into the room and you're lying on your side, you'll be given a tube to breathe with a mouthpiece and you'll be asked to breathe it in and out for several minutes. This will make you feel nice and relaxed during the test. And it does act almost immediately. If you choose to have Entonox, within half an hour of stopping breathing the Entonox, there will be no restrictions on your day. You will be able to go back to work and you'll be able to drive. There are two main concerns that people have having a colonoscopy. Some people are worried that they may go to the toilet, and you won't do that. If you've followed the bowel prep instructions, your colon will be empty, so there's nothing for you to worry about. People are also worried that it will be painful. We do give you a painkiller and a sedative to make things as comfortable as possible for you. If at any time you're in any discomfort, let a member of the team know and we'll do something about that for you. During the procedure, the doctor will pass the camera around the whole of your large bowel. During this test, he will put some air or some gas into your colon, and at times this can make you feel quite bloated and maybe uncomfortable. This is why we offer you the painkiller and the sedative. After the test, because you've had a painkiller and a sedative and you may be quite sleepy, we leave you on the bed and we'll take you through to recovery where somebody will look after you out there. Out in recovery, they will take your blood pressure, they'll give you some water, some tea or coffee and some toast, and they'll go through your discharge paperwork with you. The doctor will come and talk to you before you go and he will tell you his findings on the day. He will do a report which we fax to your doctor, but when somebody goes through your discharge paperwork with you, they will give you a copy of that report as well. If you do have any questions or concerns, please feel free to call us at Chartwell Hospital on 01702 478 885, and the number is also in your paperwork and in the link in the description below.